Hey guys, thanks for clicking on this video. If we've not met before, my name's Danny. I'm a first class biomedical science graduate and I've worked in the NHS as a healthcare assistant. Now I'm currently on my journey to becoming a doctor, and this video I'm going to share with you how to answer why do you want to be a doctor? Stay to the end for some extra tips on the follow-up questions, because I'm going to be showing you guys how I got full marks in the why do you want to be a doctor MMI section. Let's go. So, you want to get your answer for why do you want to be a doctor straight, because the chances are you're probably going to be asked it at one of your interviews. In order to get the full marks on this question, you're going to want to be persuasive and passionate about why you want to be a doctor. You've got to convince the person that's sitting there watching you, whether that be through Zoom or be in an interview setting, that you really do want to be a doctor. Now, my advice would be to keep 3 simple bullet points in your head, and you can't go too far wrong. If your answer is based around the desire to help, scientific drive, and human engagement, then you're probably going to get some good marks. And then use examples from your life or your work experience where you've seen these or realised that this is what you need in your future career. Now, I'll show you how I'll go about answering this question, and then I'm going to show you some follow-up questions afterwards, okay? So, since I was a child, I've always involved problem solving. When I used to make remote control cars with my dad, and science. I used to take fond interest in genetics. I remember when I was growing up, Dolly the sheep was quite a big, interesting story. But even today, you know, genetics is a massive topic with the rise in the designer babies in China. I think it may have been losing my great-granddad at an early age to Parkinson's that may have stirred the curiosity in how the body works and what happens when it goes wrong and how that causes death, and most importantly, how we can stop that causing death. Even though I was young, I wanted to help. I didn't know how, and I think that's why I enjoy looking after people and caring for people in a vulnerable situation, such as when I looked after a boy with complex disabilities such as autism and Momo syndrome. I think that this was instilled in me from my mother and my Christian family, but it's definitely something that I want to have in my future career. The rewarding sensation you get when you help someone in such a vulnerable situation is something you can't compare to other jobs. And it's definitely something that I want in my future career. I first learned what a career in medicine looked like by shadowing a neurorehabilitation consultant. I remember noting down how he would work closely with other healthcare professionals such as nurses, physiotherapists and occupational therapists to provide the best care package for these patients. This multidisciplinary approach is something that I've seen firsthand working as a healthcare assistant in the NHS. Having gotten a good idea of what it's like to work in a hospital, I decided that I would volunteer to see what it's like to work in a general practice as a GP. And I was inspired by the way that this general practitioner curated trust in the patient that was coming in to talk about their mental illness, which is a very, very hot topic at the moment and is an underfunded part of the NHS right now. This is something I hope to emulate if I ever get the chance. I was also mentally stimulated with the wide variety of patients that come through into the GP practice. Going to talking to people about their mental health, to then talking to an individual that's suffering from chronic fatigue syndrome, just shows the wide spectrum of cases that you get in a general practice. And this is something that I think I would really like to have in my career, as I'm really interested in the science behind these cases. Not only that, but trying to help these individuals to better manage their disease. Studying biomedical science for 3 years allowed me to explore medicine in ways that I could not have done before. I got to be involved in real-life clinical research and got to help design a possible vaccine for malaria. But I realised there was something missing from this work, that I really did need to have the face-to-face patient engagement that a doctor has and that you don't get as a biomedical scientist. in my year out of university, working as a healthcare assistant has really confirmed that I need patient engagement in my future career, and that the only job that encompasses everything I'm looking for is medicine. The economic and time constraints, as well as the increase in demand for services during this global pandemic, has produced a real challenge to healthcare professionals in the NHS. I would welcome the chance to become part of a team that meets this challenge. So that was my answer on why I want to be a doctor. It's a little bit personal to me, but that is a good basis of how to tackle the question, which is really what you guys need to think about. I definitely recommend that you prepare before you go in, because this question can be easy marks in your MMI. What not to do is don't just go over your personal statement. You want to spice it up and add some stuff that the examiner or the interview will not have seen before. So in some MMIs they'll ask you follow-up questions, and a follow-up question that I was asked was, what are you going to do if you don't get in this year to medicine? And this can be quite tough for some people, as they've not really thought about this coming up in the questions. You need to not be arrogant. You can't come into this interview feeling entitled, because as of yet they've not given you an offer. So my answer would be, I would take a year out and work as a healthcare assistant. I would gain as much healthcare experience as I can that will strengthen my application and make me a better candidate to become a doctor. And if I don't get into medicine that time, then I would consider becoming a PA or a physician associate, because this role also encompasses a lot of what you get as a doctor. Another question you might be asked are, what challenges do you think you might face if you were a doctor? It's important that you appreciate that there are challenges of being a doctor. I think the most important one is how stressful it can be. The likelihood is, if you're working in a hospital, you're going to deal with patient death. The counter argument to that is that there are lots of grief advice services that can help you with this, and you also have some really supportive colleagues. Not only this, it's a massive commitment to your life, and you will not have as much time outside of work as you do in other professions. But building a good support network of people that you trust in your life and hobbies that you do outside of medicine will relieve the stress that sometimes you can face when you are a doctor. But the rewarding side of the job outweighs the negatives, in my opinion. Hey, thanks for watching this video. If you got this far, then you're going to do better than the candidates that didn't get to this point in the video. I wish you all the best in your upcoming interviews if you have them yet. If not, good luck, and I hope that you hear soon. If you like this kind of content, consider clicking the subscribe button and clicking a thumbs up. If you subscribe, you get notifications when my content is released, and it will just improve you as a student and help you to become that medic that you want to be. Thanks for watching, and ciao.